We're about to begin Audio 3 of Level 1 to Certification. Medicine, the search, the process. At present time, the process pharmaceutical following their search for new medicine is well known. First, company scientists are sent to the jungles of the world to search for shamans, life keepers, medicine men and women. Second, scientists observe local ethnobotany and record shamanistic practice in hopes of discovering new drugs. Third, promising new plant materials are sent to laboratories all over the world where the process is to extract what is believed to be the principal medicinal constituent, synthesize that principal constituent, and reproduce it for new medicine. We now know that extracting a part from the whole changes the natural balance and the original observation, feathering a change in performance. This process has proven to be valuable in some instances, but not in the case of antibiotics, bacteria, and viruses, which has been known to not only adapt to the synthetic copy of the natural whole, but they also have been known to turn it into foodstuff. While present medical practice struggles to produce the new wonder drug, the superbugs seem to be winning the race. Meanwhile, back in the jungle, the shaman, medicine men, women, and all those working with plant medicine continues to use the same plant materials and information that has been passed down for generations and continues to heal with the same results, without having to change their formulations and without creating superbugs. Quote, classical drug research looks for a single active substance and either extracts them as they are or creates them in a test tube so it can be manufactured on a large scale. It leads to the active substance being given on its own. Modern research is showing that plants contain secondary enhancing and or side effect eliminating substance. With this observation and further research, we can begin to conclude that bacteria, viruses, fungus, in fact, all living things have the capacity to adapt to synthetic chemical copies of natural medicines. They're evolving with a built-in immunity to survive and the capability to adapt to the next synthetic chemical copy of the natural whole. Adaptability seems to be the mode of survival of the species, clearly showing the benefits of working with a natural whole and the uncertainties we face when we attempt to synthetically mimic their natural performance. The question now arises, will today's healthcare consumer demand a reevaluation of both prescription and natural medicine and the selection of the best non-toxic approach to healing? As the health scenario plays out before our eyes, we're witnessing the adaptability of this organism, and at present time, research is showing the following. Hospitals and prescription drugs, there are about 100,000 deaths a year in the United States from properly prescribed, properly administered drugs. There are 200,000 severe injuries a year. Neuroscientist Bruce Pomeranz, involved in this research, stated, doctors currently under-report drug reactions. Dr. Bates of Howard Medical School further stated, this data suggests that healthcare practitioners may miss or pass over many ADR, adverse drug reactions, that occur even among fatal death, making it the fifth or sixth leading cause of death. Nosocomial hospital-acquired drug-resistant infection. Dr. William Jarvis, active director of the Center for Disease Control, has stated, between 1975 and 1995, the hospital-acquired infection rate increased about 36%. He further estimated that today, 2 million patients develop a hospital-acquired infection in the United States each year. Of that number, 90,000 die as a result of those infections. Fred Turnover, also from the CDC, added, it is survival of the fittest. You're most fit if you're bacteria and you're resistant to antibiotics. Now let's look at number 4 of the 4 areas of good health. The foods we eat. PBCAM practitioner consultant approach foods by looking at what foods feed what illnesses and what foods are known to starve an illness. We also look at this change in eating as a new way of eating rather than a diet. We begin just like with the products we use by reducing and or eliminating an ingredient list. After all, the black beans in the can are not black beans. They are black beans with an ingredient list of chemicals with known or suspected cumulative health damage. When we look at meat and meat byproducts, we're not looking at growth hormones and antibiotics, preservatives, and more. We're now looking at dead matter in the most acid state. Let's begin by looking at the process of decomposition. When we begin to die, our bodies quickly begin to turn acid. This is the way we naturally decompose and go back to nature. Emergency personnel are trained to inject a solution of sodium bicarbonate, which is alkaline, to stop the process of decomposition, acid, in patients. When an animal is killed, it begins to turn acid. This begins their state of decomposition. Dead animal food are great food to feed cancer cells, inflammation, acid reflux, joint pain, and more. The more we look, the more we see that plant-based foods are the ones that starve many of our illnesses because of their anti-inflammatory properties, as well as live vitamins, proteins, minerals, detoxing effects, and more. Once again, we need to pay attention to how we feed our condition and learn how to starve our condition. Most of us think we need dead animal meat as food for our protein, not knowing of the amount of plant-based protein, vitamins, and minerals in plant-based foods. In addition, plant-based foods are very effective anti-inflammatory and detoxing. Based on our observation and today's research, we recommend a person to go on an 80 to 90% vegan diet, consuming mostly fresh vegetable, live foods, with only 10 to 20% of our food intake being animal-based foods. For most of us, that's reversing what we eat. For those who eat a lot of meat-based food and then eat a salad on the side to be healthy, we need to change that around. The NutriBullet is recommended as an economical system to extract the properties of green food, and we recommend daily use. Nowadays, you can choose uses from a number of different manufacturers and price ranges and can make use from a leaf, which is what is needed. The choice is yours, but we recommend you choose one and begin to extract daily so you too can see and feel the difference it makes on your health. We've seen reports of the following within 1 to 4 weeks of people starting to extract and consume vegetables and fruits as juices on a daily basis. Keep in mind this is anecdotal information, not yet proven by science. This is what we have seen. Sugar craving reduce or no more craving within the first 2 weeks. Salt craving reduce or no more craving within the first week or two. Pastries, white bread craving reduce or no more craving after the second week. No more craving for sodas, no artificial drinks after the second week. Diabetics report reduction of insulin after 3 weeks. Reports of no need for insomnia medication after 3 weeks. Erectile dysfunction for 6 months gone within 4 weeks. Stomach bloating, no more after first week. And there are so many more benefits as anyone that practices extraction has seen. Remember, when you're drinking 1 to 2 glasses of freshly liquefied vegetables a day, you are starving the cause of all your illness. And you are starving inflammation. In search of alternative health care, research indicates that over 87% of Americans are choosing alternative therapies for their health care. This number is increasing. This clearly creates the need for research, education, regulation, and validation. And of equal importance is the need for both mainstream health practitioners and alternative health practitioners to work together. By working together, we're making an effort to communicate and begin to integrate alternative care products with modern medical practice for the health and benefits of those 87% or more of the patients that are choosing alternative therapies for their health needs. Today's evolving alternative practice are best molded to complement modern medicine, interacting as a revolving door checkpoint for today's healthcare warnings. Complementary alternative medicine represent that subjective practice are not an integral part of the dominant healthcare system in the U.S., but are still used by patients to supplement their health. An understanding of the continuously changing condition affecting healthcare has always been of value to all healthcare practitioners. To practice healthcare is a lifetime commitment to constant research and learning. Good health advice depends on up-to-date research and environmental awareness. In Florida, Senate Bill 1324 assures the right of all residents of the state to choose alternative medicine as their main health treatment. It also gives the right for all the licensed healthcare practitioners to choose alternative practice as mainstream treatment for their patients. The olfactory system, in brief. Smell is one of the five senses by which odors are perceived. The nose, equipped with olfactory nerves, is the organ of smell. The olfactory nerves also account for different tastes of substance taken into the mouth. Most sensations of taste are really smells. Smells belong to our chemical sensing system, or the chemosenses, where a multitude of aromas, both negative and positive, bombard us on a daily basis, affecting us before we can perceive it. And most of the time, this operates on a subliminal level. Not to pay attention to our exposures is to deny us a clear view into many of our health risks and implications. Odors travel through the only sense that registers finding, directly to the brain and the limbic system. Given adequate stimulation through the olfactory system, we can produce a change, either negative or positive, depending on our environmental exposures. The specialty of this sense organ is the fact that the nervous sensory cells are directly and immediately in connection with the outer world, or the respiratory air, sending olfactory information directly and immediately to the brain and producing multiple effects on our daily life. We're now beginning to realize the effect it has on our health, our behavior, and our lives. The following, neuroscientists tells us we have about 100 million sensory nerve cells. Nerve cells are equipped with a protein called receptors. Receptors carry information at 500ths of a second to the olfactory bulb before a protein called BAR2. It starts a process that completely inactivates a stimulant odor receptor. This is of core importance to understanding why we should pay attention to what we smell and our exposures to different chemicals. When we enter a bakery, we're bombarded with many aromas. After a few minutes, BAR2 moves in and we no longer smell the same aromas. We can't smell our home, but we can smell our friends' homes upon entering. In the morning, we apply perfume, and by the end of the day, someone may compliment us on how good it smells, but we can no longer smell the fragrance. This is a simple example of BAR2. Working in energy efficiency building, we're exposed to chemical diffusion, humidity, mold, virus, animal dander, and bacteria. BAR2 may inhibit us from recognizing these airborne intruders, but the effects on health are well documented as sick building syndrome. According to Dr. Robert Lukowitz of Duke University, BAR controls the functions of the receptors, and receptor controls just about everything that happens in a body. This observation grants PBCAM practice validation in its therapeutic effectiveness, as a smell is able to influence emotions, appetite, survival behavior, sex, and memory. The olfactory bulb acts as a switching station, sending messages to various parts of the brain. Whatever we touch, hear, or see has to pass through the thalamus gland for interpretation before it is sent to various parts of the brain and the nervous system. Smell is the only one of the senses that does not get processed by the thalamus. Neuroscientists Richard Axel and Linda Buck won the Nobel Prize in 2004 for the research and validation on how smells affect emotions, appetite, survival behavior, which is chemical balance, sex, and memory. For further information, please see the following YouTube video as it explains some of their findings. Their Nobel Prize winning research found the following. The cells send thin nerve process directly to distinct microdomains called glomeruli in the olfactory bulb. Receptor cells carry the same type of receptor, send their nerve process to the same glomeruli, even though odor receptor cells are located in different areas of the olfactory epithelium. There's some 2,000 well-defined glomeruli. There are those about as many glomeruli as the types of olfactory receptor cells. Most odors are composed of multiple odorant molecules, and each odorant molecule activates several odorant receptors. This leads to a combination code, a combinatorial code, forming an odorant pattern, somewhat like the color in the patchwork quilt or in a mosaic. This is a basis for our ability to recognize approximately 10,000 different odors. Actual research group demonstrated in mice the role of the receptors in the linkage of odorant receptor cell and glomeruli. From these microdomains in the olfactory bulb, the information is relayed further to other parts of the brain where the information from several olfactory receptors is combined and decoded. In the glomeruli, we find not only the nerve process from the olfactory receptor cell, but also their contacts with the next level of nerve cell, the mitral cell. Each mitral cell is activated only by one glomerulus, and the specificity in the information flow is thereby maintained. Bugs show that these nerve signals in turn reach defined microregions in the brain cortex. Here the information from several types of odorant receptors is combined into a pattern characteristic for each odor. This is interpreted as and led to the conscious experience of a recognized odor. Therefore, we can consciously experience the smell of an odorant and recall this olfactory memory at all times. Many of the nerve pathways lead to the temporal lobe, which stores memory. Others connect with the most ancient part of the brain that deals in the traffic of emotions, sex, appetite, and survival behavior. On memory, most of us have experienced how certain cells can trigger a specific memory, which can either be positive or negative, and most of us are not even cognizant of this happening. All smell recognition have the ability to cause positive or negative behavior change. Example, when I was doing research in a psychologist's office for 6 months on documented cases of depression and how essential oils affect them, there was a question that I used to ask in the questionnaire was how did the person feel about baby powder? Now, it was okay to have a choice. It was okay to say, I don't like baby powder. But when there was an emotion attached to the choice, then I will make a notation. Later on, the psychologist will check on this, and 10 out of 10 of the cases were abused during childhood, so they connect their experience with the smell of baby powder. We see the same thing in many folks that act differently with the smell of pine, of Christmas tree during the Christmas season. It's a smell recognition. You either are extremely happy, or some of us could be extremely sad, depending on the different situations we experienced in those times where those smells were present. Then we have emotion. Pheromones from the Greek pheron, which means to carry, and hormone, to excite. Pheromones are chemical that we as human and animals produce in an amount too small to be smelled, but are still detectable by the olfactory system. This can trigger an emotional response, and just as in the animal world, pheromones serve as a form of subliminal communication for humans. Pheromones are airborne chemicals that we diffuse and are found in bodily fluids. Because they have been known to induce changes in behavior, studies are being done on the effect of pheromones present in the feces and urines of babies. These pheromones are suspected of causing a violent reaction in a violent-prone individual. This was a topic of research taking place at Florida State University by Mary Booker and C. Ray Jeffrey. In observing the evening news report regarding child abuse, they noted that incidents escalated after the child urinated or defecated. This is of importance information, and this is something we share with any family that has a new baby. Before they leave the baby with anyone, the babysitter, the grandmother, the mother-in-law, you want to be able to change the diapers with them. It's okay to react to the smell. It's not okay for the smell to turn someone into a Jekyll Hyde personality. That's what you're looking for. It is real, and if you begin to look at the abuse cases, you're going to find the common denominator: the baby defecated, urinated, and the person who went wild. Sex. That special chemistry we feel with that special someone, which is euphoric, are pheromones in action. Incidentally, expert tells us that this feeling or state of mind lasts for about 2 years. Maybe this could be the reason why some of us develop a pattern of 2 or 3 year relationship. The essential oil of ylang ylang has been reputed throughout history as being an aphrodisiac, while the essential oil of marjoram is a well-known anti-aphrodisiac and an important essential oil to use when a couple is breaking up, when there's arguments, where also when someone is very active sexually, we're able to make a perfume and use marjoram and other oils, and that could help as an anti-aphrodisiac. Appetite. During the Roman Empire, the Roman army carried fennel seeds during the wintertime as they marched across continents. The fennel seeds were used to satisfy their hunger when there was a shortage of food. Today, we use the smell of fennel, essential oils, in an inhaler to suppress appetite, and the smell of juniper berry to increase appetite. Survival behavior. This pertains to our survival mechanism. Research is still going on this function of survival. Facts about your smell, about the sense of smell. During evolution, our sense of smell was the first to develop of our 5 senses. Throughout time, the small lump of olfactory tissue atop the nerve cord grew into a brain. The olfactory nerves constantly regenerate, and they're the only nerves in the body that do. They live about 1 month, and when they die, new ones sprout from the nasal lining to replace them. Negative odors such as smog molecules and some man-made chemicals can cause stress, allergic reaction, and as previously mentioned, sick building syndrome. Constant exposure to damaging, sometimes toxic molecules in the air kills most olfactory neurons in only 4 to 8 weeks. Over the years, this devastation could wreak havoc in our health. Fortunately, our olfactory neurons can reproduce and replace themselves as they wear out, and this ability is an important factor in our survival, especially when most of us, live in an enclosed environment and work in an enclosed environment and exercise in an enclosed environment. Lifetime awareness. As we have already mentioned, we're concerned with the chemicals found in products we use, chemicals and particulate matter in indoor air, sick building syndrome, and numerous environmental exposure of unknown toxic energy cocktails that permeate our living, work, and educational environment. In practice, we're also concerned with the environmental effects on our physiological and psychological process, our senses, which in turn influence our health. The following information is on the importance sensory awareness play in our health and the practice of plant-based health. Let's talk about sense therapy. Sense therapy is not a new concept. In 1810, John Locke of England and Jean Rousseau of France developed the concept that learning came only through the senses and that everyone could develop the ability to learn if given adequate stimulation. Their observation has been integrated into all levels of education. Working with the senses is becoming a useful tool for behavioral practitioners in various healing modalities. It is especially effective for the PBCAM practitioner consultant who is working with aromas which influence appetite, sex, survival behavior, emotions, and memory. The PBCAM practitioner consultant in consultation and practice is able to educate their clients on the awareness of environmental absorption or sensory bombardment and their positive negative effect on their health. The senses have been used throughout human evolution for survival. Information about our environment is filtered through our senses and often affect us before we can conceivably perceive it. Most of the time, sensory perception operates on a subliminal level. A brief understanding of our senses is essential for the PBCAM practitioner consultant in order for us to understand how our environment exposures affects our health. Once again, if one is able to influence one or more of the senses, one can provoke a change. An awareness of negative or positive environmental influence is vital to all healthcare practice and is a first step to health in the PBCAM practice. Many times we go through life exposing ourselves, mostly without knowledge, to this involuntary and spontaneous encounter. Up to now, we have been focusing on the sense of smell, which is what we practice in PBCAM concept. That said, it is of health benefit to both the practitioner, consultant, and their clients to possess some knowledge regarding the other senses, which are equally influenced by our environment and which have multitudes of known and unknown health effects. The following information will begin to introduce the CAM practitioner consultant, in brief, to some of the influence of our senses. It is meant to evoke interest in the PBCAM practice consultant to seek additional information, since data on the environmental health effect of sensory exposure and health continues to grow. Our sense for survival. Since conception, the five senses guide us through the development and survival. Every living thing on earth communicates through the senses. Modern research supports the fact that we as human and natural beings also depends on sensation information guiding our interaction within our environment. We're constantly bombarded with environmental stimulus which serves as catalysts to actions, reactions, and health implications. What we perceive and how we perceive it are shown to have the most direct influence on our lives and welfare. By now, we have established the fact that through our senses we absorb information and we absorb our environment. As Diane Ackerman points out in her book, A Natural History of Our Senses, each day we breathe about 23,040 times and move around 438 cubic feet of air. She goes on reminding us it takes us about 5 seconds to breathe, 2 seconds to inhale, and 3 seconds to exhale. And in that time, molecules of odors flood through our system. For the PBCAM practitioner consultant, aromas are of great importance. Most chemicals penetrate the body via the olfactory system and the skin. Their influence is immediate, direct, and accumulative. The PBCAM practitioner consultant is trained to assess and evaluate an individual's toxic environment and create a non-toxic setting, providing a format for positive stimulation in their life. This is becoming an integral part of healthcare as exposure to synthetic chemical continues to create havoc on human health. Let's take a look at our senses, as this is what we observe when we are consulting an individual in our practice. Sight. It has long been recognized that what we see can have profound psychological as well as physiological effects on humans. Neurologists and anatomists have recently demonstrated the existence of nerve pathways extending from the retina that are separated and apart from the pathways linked to the sight center of the brain. These newly discovered interconnections link the eye with a neurological center in the brain that influence and control many of the body's regulatory functions. Such regulatory centers typically exert their control via neurological or biochemical means. We know that if we want to evoke depression or sadness in an individual, we will dress them in black clothing and make their living environment dark. Opposite to this, if we want to bring peace and serenity, we will dress them in pastel and color their environment light blue, light green, or other similar colors. In addition, red has been known to cause aggressive behavior, and he goes on with color evoking emotions all through our life. Color therapy is becoming a valuable tool in healthcare, and it is in the mind of the PBCAM practitioner consultant during their consultation. Sound. The influence of sound and its implication has been observed historically from courtship to battleground, from a spiritual practice to entertaining to selling a product or an idea, and from the first music note ever heard to a sound-induced memory. Today, the application of music therapy includes work in psychiatrists and psychosomatic clinics and rehabilitation centers for internal medicine in terminal care and for those physically and mentally handicapped, as well as in geriatric institution, pediatric, and youth psychiatrists, not to mention elevator. Music therapy is also being used increasingly for prison inmates and troubled individuals. Studies have shown the benefits in the transformation of problematic behavior and the promotion of social learning. It has always been a part of mind-body practice. These types of complementary alternative medicine tend to appeal to all of our senses for that positive change in our health life. Dr. Victor Marcial Vega, an oncologist, CAM researcher, a pioneer in CAM practice, and a friend, and a medical encyclopedia to most of the information um, beginning during the 90s, recorded his meditation CD Stillness and instructed 50 of his patients to listen to it while lying down with their eyes closed for a minimum of 23 minutes daily. At the end of the 2 weeks, he observed the following results. 1. All patients reported feeling calmer and having better sleep patterns and less stress. 2. Blood pressure dropped from 10 to 20 points in 80% of the patients with uncontrolled hypertension. 3. The need for medication decreased to 20 to 30 of the initial dosage in all patients for at least one medication. 4. In 75% of the patients, the requirements for nutritional supplements decreased. They needed fewer amounts of supplements to achieve the same results. Number 5. There was a decrease in the need of pain medication and pain in patients under medication for pain control. Number 6, all patients reported an improvement in their ability to be more aware of their bodies and the world around them. And number 7, there was an increase in the speed of white blood cells. That's important. In the speed of white blood cell under microscopic analysis of their blood in 85% of the patients indicated an improvement in their immune system. Throughout music history, we have observed a gauntlet of behaviors attributed to the music beat of their time. From aggressive to pacific, the sound of the times have influenced our behavior and our life. Now, let's add to the previously mentioned dark, depressing environment, funeral music, and to the bright pastel environment, waterfall music. We just increase the effect by one more sense, evoking either a negative or a positive reaction. The sense of touch. Touch therapy has been used throughout our evolution. One of the first early examples in medical history is that of royal touch. For more than 700 years, the anointing king of France and England were regarded by their subjects as miraculous physicians, whose mere touch will cure physical illness. The patient had only to come in the presence of the king and make contact with his sacred person to be healed. As Jonathan Miller points out in his book, The Body in Question, touch therapy have their support from the Asian mystical notion of the ether, a spiritual substance halfway between mind and body, traditionally thought to be capable of transmitting influence from one end of the universe to the other. Isaac Newton provided a convenient rationale at the end of his book, Principles of Natural Philosophy. Newton considered the possibility that the universe was permeated by an ether and that this might explain the transmission of light, magnetism, and gravity, giving the birth to ethnophysiology, the science dealing with physical organs of sensation. Touch therapies have played a part in the development of healthcare, presently diversifying into different formats such as Reiki, therapeutic touch, pranic healing, and hands-on healing, all of which evolved from the laying of the hands, energy healing, and ancient healing formats. Today's research shows the effectiveness and importance of touch therapy. In a growing trend, energy healing practitioners are found working side by side with modern medicine as part of complementary alternative medicine. Now, to the dark, bright, sad music, happy music environment previously mentioned, let's now add negative, toxic, or positive people. Now we either have a real depressed, tired, sad, surrounded by negative energy sapping humans, or very bright, energetic, positive, radiant individuals surrounded by positive human energy. Of course, this is without adding the daily toxic exposure, but nevertheless, we begin to see the effects of our environment on our health and the importance of this awareness to any health practice. Let's briefly review Level 1. In Level 1, we learn the health importance and awareness and connection of environmental chemicals in our health. We specifically focus on the 4 areas of good and bad health, which consist of chemicals in the air we breathe, chemicals in the water and beverage we drink, chemicals in the products mix we use, and chemicals in the foods that we eat. Briefly, our recommendations are as follows. For the air, gas off your home mostly by opening all windows for 30 minutes. Run your AC for 10 minutes while the windows are open. Place AC vent filters in the AC vent for each room so fiberglass insulation don't fall on you and your family every night. And by the way, this is a good exercise to begin to turn your home and turn your family's health and your health um, within the system, and begin to follow it so you can actually begin to feel the difference when these recommendations are put in place. For the water, drink filtered water. Do not drink artificial flavored drinks. Also cook with filtered water. For the products meds, learn to make your own non-toxic products. View level 1 blending videos to learn about the replacement of toxic products that we clean in the house. The other blending videos will show you how to replace some meds and some other products. Reduce the number of plastic synthetic materials in your life, in your home. For the food, do not consume food that feeds an illness. Do not consume food that starves an illness. Do reduce or eliminate any food with an ingredient list. Eliminate inflammation food by replacing them with anti-inflammatory food. This is the end of Level 1 lecture. Now you can begin to view the blending sessions of Level 1. For questions and answer, you can call us at Tuesdays through Thursday, 10 a.m. to 7 p.m. at 786-597-3760, or you can email us at education@acameducation.com. That's A-CAM education.com. Once again, thank you for choosing plant-based health education for your training, and we'll see you in Level 2 to 4 levels to certification. Thanks for your interest.